Carbamazepine, also known as Tegretol, is a medication used to prevent and control seizures. It is also used to relieve certain types of nerve pain, such as trigeminal neuralgia. This medication works by reducing the spread of seizure activity in the brain and restoring the normal balance of nerve activity. When taking Tegretol, it is important to follow the dosage instructions provided by your doctor. Typically, it is taken 2 to 4 times a day with or without food. It is important to take it at the same times each day to maintain a consistent level of the medication in your body. It is important to note that Tegretol may take some time to start working, so it is important to continue taking it as prescribed even if you do not notice immediate effects. Be sure to talk to your doctor about any concerns or side effects you may experience while taking this medication. Before taking Tegretol tablet, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor. If you are using the chewable tablets, chew them thoroughly before swallowing. If you are using the suspension form, shake the bottle well before each dose and measure the dose using a special measuring device/spoon. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start at a low dose and gradually increase. Take this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse if the drug is suddenly stopped. Tell your doctor if your condition does not get better or if it gets worse. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. Common side effects of Tegretol tablet may include nausea, vomiting, dizziness, drowsiness, constipation, dry mouth, or unsteadiness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, including severe or persistent headaches, signs of liver problems, like ongoing nausea or vomiting, loss of appetite, stomach or abdominal pain, yellowing of the eyes or skin, dark urine, signs of kidney problems, mouth sores, fainting, abnormal heartbeat, unusual eye movements, changes in vision, joint pain, swelling of the ankles or feet, pain, redness or swelling in the arms or legs, numbness or tingling in the hands or feet, or signs of low levels of sodium in the blood, such as extreme drowsiness, confusion, seizures. Some people who take anticonvulsants like Tegretol may experience depression, suicidal thoughts or attempts or other mental or mood problems. Notify your doctor immediately if you or your family notice any sudden or unusual changes in your mood, thoughts, or behavior. Although rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Tegretol tablet, also known as carbamazepine, may rarely cause very serious skin reactions, especially in people of Asian/South Asian descent. Before starting this medication, your doctor may order a blood test to measure your risk. If the test shows that you are at greater risk, your doctor should discuss the risks and benefits of Tegretol tablet with you. These skin reactions have mostly occurred within the first few months of treatment. If you develop symptoms such as skin rash, blisters, peeling, itching, or swelling, seek medical help right away. In addition, Tegretol tablet has rarely caused very serious blood disorders, such as aplastic anemia and agranulocytosis. Your doctor will monitor your blood counts to minimize the chance of these side effects, so it's important to keep all medical and lab appointments. If you experience signs of infection, unusual weakness, shortness of breath, or easy bleeding/bruising, seek medical help immediately. It is important to follow your doctor's instructions and to discuss any concerns you may have about Tegretol tablet. Before taking Tegretol tablet, make sure to tell your doctor or pharmacist if you are allergic to it or any other anti-seizure medications or tricyclic antidepressants. Also, inform them about your medical history, especially if you have any blood disorders, heart disease, kidney or liver disease, mental/mood disorders, or mineral imbalances. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana as it can increase these effects. It's important to not drive or operate machinery until you know how this medication affects you. Also, be cautious in the sun and use sunscreen and protective clothing as this drug may make you more sensitive to sunlight. If you have diabetes or need to limit/avoid sugar in your diet, talk to your doctor about using the chewable tablets or suspension safely. Inform your doctor or dentist about all the medications you use before having surgery. For older adults, there may be an increased risk of certain side effects such as confusion, unsteadiness, or irregular heartbeat. If you are pregnant or planning pregnancy, discuss with your doctor the benefits and risks of using this medication during pregnancy. It's important to consult your doctor before breastfeeding while using this medication. When taking Tegretol, it's important to be aware of potential drug interactions. Some medications, such as certain azole antifungals and orlistat, may interact with Tegretol and affect its effectiveness. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, taking MAO inhibitors with Tegretol can cause a serious drug interaction, so it's important to avoid them during treatment with this medication. It's also important to discuss with your doctor if you are taking any hormonal birth control, as Tegretol may decrease its effectiveness. Finally, be careful when taking other products that cause drowsiness, as they may interact with Tegretol. Always check the labels on all your medicines and consult your pharmacist to ensure safe use of these products. If someone has taken too much Tegretol and has severe symptoms like passing out or difficulty breathing, it's important to call for medical help immediately. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slowed breathing, loss of consciousness, muscle twitching, uncontrolled movements, and a very fast heartbeat. It's important not to share Tegretol tablet with others. Before starting this medication and while taking it, your doctor may want to conduct various tests such as complete blood count, blood mineral levels, kidney/liver function, eye exams, and carbamazepine blood levels. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you forget to take your Tegretol tablet, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Tegretol tablets, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and make sure to keep them out of reach of children and pets. As for disposing of Tegretol tablets, it's best not to flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, it's important to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. In terms of the benefits of Tegretol tablets, they are commonly used to treat certain types of seizures and nerve pain, as well as to prevent mania and treat bipolar disorder. The daily dosage and optimal timing for taking Tegretol tablets can vary depending on the individual's condition and response to the medication, so it's important to follow the guidance of a healthcare professional. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.